Hi, I'm Dr. Cofton, and we're here at Alpha Plus Dental Center in Brookline, Massachusetts, and I just wanted to talk to you about a unique procedure that we do here in our office called PRP therapy. Some may know it as platelet-rich plasma. And so we're going to talk about the procedure and how it works. So the procedure entails, well, the purpose of it is to induce accelerated healing. So what we do is we draw the patient's own blood, we concentrate it in a centrifuge, and then we either make a fibrin clot from it or we inject it as a liquid back in. It becomes highly concentrated with growth factors, with cells that promote healing, white blood cells. So you get this mixture of concentrated cells in an area which stimulates fast healing. So we're going to go ahead and demonstrate how quick and easy this is done. So we're going to tie off, create a tourniquet. Nice and tight. We are going to make sure everything is nice and clean as it should be. We use a special light so that we're not guessing. So vein is right there. Right there. So just 1 second. We are here. And the vein is right here. 1, 2, 3, deep breath. And here we go. Just for demonstration purposes, we're gonna do 2 tubes. Which I know that's an issue. It folds like this. Okay. Almost done. Okay, and alright. We're gonna get the Band-Aid on. Hold pressure on this one. So this, very important. We're gonna put it in the centrifuge. We want them across from each other. We've got this set to 8 minutes to 2200 RPMs. And what this does is it, as you can tell, spins it up beautifully. And so now we wait for 8 minutes. So while our centrifuge is running for the next 8 minutes, I just wanted to answer a few questions that we've been getting. One of the questions is, who is a good candidate for PRP therapy? Basically anybody who's going to be receiving any kind of extractions, implants, bone grafting, anybody who has gum disease, we can essentially implement, PRP into their treatment plan to increase the chances for success. Anytime PRP is utilized, it's a great benefit to the patient. It's essentially a painless procedure, and you're using your own blood cells to stimulate growth and to stimulate faster healing. Following up to the question, who's a good candidate for PRP, is what is the success rate of PRP? So the success rate of PRP is essentially 100% unless for some reason we're not able to get blood. If the veins are, if the patient is really dehydrated, or there's just no veins to find, but we can find them maybe on the top of the hand somewhere. But the success rate is anytime we can use your own blood and concentrate it, spin it down to where we have cells that are in a small amount and there's a lot of cells there, the success rate is going to be much, much better than if you don't use it at all. So I guess my answer to that is the success rate for PRP is always very good. So to follow up on having a very, very high success rate with PRP therapy, I guess I just need to discuss who is not a good candidate to receive platelet-rich plasma. So there's a small population of people that receive blood thinners. Coumadin, also known as warfarin, Plavix, Eliquis, all these medications that patients are on to thin the blood, they are not good candidates. The blood is too thin. It doesn't coagulate correctly when we spin them in the tubes. So with those patients in particular, I would need to get in touch with their primary care physician or their cardiologist to find out if we can actually take them off blood thinners, for roughly 5 days before the procedure is done. So a lot of patients are wondering, what is the average cost of platelet-rich plasma therapy? It really depends. If you're coming in for a specific particular procedure where we're solely focused on, say, injecting PRP into the gums, the procedure starts at about $200, but if it's a part of a larger bone grafting procedure or several implants with bone grafting, we just include it into the surgical price, because we just want the most success for you as the patient and for us as the practice. So it just gets included into the fee. And a lot of patients will ask, is this a procedure? Is PRP covered by insurance? And unfortunately today, the insurance company doesn't see it as a medical necessity. So the insurance benefits work solely on, do they deem a procedure as medically necessary? And today, platelet-rich therapy, it's a helpful procedure to help maximize our success, but it's not a medical necessity, and that's why insurances still don't cover it today. All right, so it looks like our centrifuge has stopped. So we open it up, and what was before sort of pure red, blood all the way up, now we've got red blood cells that have been spun and basically destroyed here, which released a lot of growth factors, and there's a lot of growth factors in this material here. So now what we do with this is we open it up, and if we do this really, really fast, right in the beginning of the procedure, we can draw up cells into a syringe and inject, or as you can tell now, the top portion is called a fibrin clot. Now that I have these open, what I'm gonna do is I'm gonna kind of separate this upper white portion away from the destroyed red blood cells. And we are going to pull it out and form our membranes. We don't need this red part here, so we cut it off. It stays in the tube. All right, so this is a fibrin clot. This is loaded with a lot of the patient's growth factors from the platelets, bone stimulating cells, cells that will call in the action of to create new blood cells in the area. Everything that essentially you need for healing purposes. So we're going to do the same thing with this one. Pull it out. And so now, these are really, really large fibrin clots. If you don't need such a large clot, you can cut this into two. And for instance, from these two large ones, we can pack 4 extraction sockets, 4 wisdom teeth sockets. So you can cut this in half. You can place it right into this little tube. Use this tiny little weight. And what this will do is it'll compress it down. And then here we can form membranes. So all I would need to do is put this weighted plate on here. And we just wait several minutes. It crushes it down, and it essentially forms a biologically active membrane that's loaded with cells, that's placed over a wound site, placed over a bone grafted site, and sutured into place, and it definitely promotes, accelerated healing. So now here we have our thinner membrane version. If I had let that sit a little bit longer, these would be much, much thinner. And then also what happens if we're trying to simultaneously do a bone graft, the thrombin that gets squeezed out of here goes into the bottom of this well, and this is all the patient's thrombin. So I can use this to create a bone clot. So I can use bone particulate and saturate it with the patient's own cells and thrombin and use that as a bone grafting material. And this is the procedure in a nutshell, but there's so many other things you can do with this. So, in summary, we just talked about the plasma therapy procedure in dentistry, which we actually call platelet-rich fibrin. If you still have any questions regarding this procedure, you can contact my dental office in Brookline, Massachusetts, or you can comment and ask a question below. I will personally make sure to answer that question for you.